Have you ever wondered, why do some people who seem perfectly healthy suddenly suffer a stroke without any warning? No chest pain, no dizziness, no shortness of breath until it's too late. Here's the truth. Atherosclerosis doesn't show up overnight. It develops slowly, quietly, often over years. And if you're over 50, it could already be building up inside your arteries without you even knowing. So how can you tell if it's creeping up on you? What are the early warning signs that your arteries might be clogging, even if you feel fine? Is there a way to clean your blood vessels naturally without relying on medication? And most importantly, how can you stay strong, healthy, and confident after 50 without living in fear of stroke or heart attack? That's exactly what I want to share with you today. But before we dive in, don't forget to hit the like button, share this video with someone you care about, and subscribe to our channel. It helps us keep creating valuable content to support your health and well-being as you age. Now let's what is atherosclerosis? A simple yet accurate explanation. Atherosclerosis is a condition that quietly develops over time and can have life-threatening consequences if left unchecked. At its core, atherosclerosis is the buildup of plaque inside the arteries, those essential blood vessels that carry oxygen. But what exactly is this plaque? It's a sticky mixture made up of cholesterol, fatty substances, dead cells, calcium, and other waste products circulating in your blood. Over the years, this gunk slowly accumulates along the inner walls of the arteries, forming thick, hard deposits that narrow the blood flow channel. Imagine a pipe in your home that slowly clogs with grime and rust. Over time, the water flow weakens, or worse, stops altogether. This condition doesn't usually appear overnight. It begins with damage to the endothelium, the delicate inner lining of your arteries. This damage can be triggered by factors like high blood pressure, smoking, diabetes, high cholesterol, or even chronic stress. Once the endothelium is injured, LDL cholesterol, often referred to as bad cholesterol, sneaks in and gets trapped in the artery wall. Your body senses this as a problem and sends white blood cells to clean it up. But instead of fixing the issue, this immune response often makes things worse. The site becomes inflamed, more debris collects, and over time, as this plaque builds up, it causes the arteries to become narrower and less flexible. This process is why people with atherosclerosis often develop high blood pressure. The heart has to work harder to pump blood through stiffened, narrowed arteries. Eventually, the plaque can rupture, causing a blood clot to form. If that clot blocks blood flow to the heart, it results in a heart attack. If it blocks blood flow to the brain, it's also important to clear up a common confusion: the difference between atherosclerosis and arteriosclerosis. While they sound similar, they're not quite the same. Arteriosclerosis is a general term that refers to the hardening and thickening of the arteries, which often comes naturally with aging. Think of it as the umbrella term. Atherosclerosis, on the other hand, is a specific type of arteriosclerosis that involves plaque buildup. So, while all atherosclerosis is arteriosclerosis, not all arteriosclerosis is in many people, atherosclerosis goes unnoticed until it causes a major event like a heart attack or stroke. That's because early stages rarely produce symptoms. The process can quietly affect arteries in the heart, brain, kidneys, or limbs without any warning signs. That's why doctors often call it a silent threat. Understanding how atherosclerosis develops is crucial, especially for seniors. As we age, our blood vessels naturally lose elasticity, and the cumulative effects of diet, lifestyle, and medical conditions start to add up. Knowing what's happening inside your arteries before symptoms strike can help you take steps to slow or often overlooked symptoms and why they're so dangerous. One of the most troubling facts about atherosclerosis is how quietly it progresses. According to major health organizations like the CDC and Cleveland Clinic, more than 60% of people living with atherosclerosis have no idea they have it until they suffer a major event like a heart attack or stroke. This silent nature makes the disease especially dangerous, particularly for older adults who may already have other medical conditions that mask or mimic its symptoms. What makes atherosclerosis so deceptive is that its early signs are often mild, vague, and easy to dismiss. Many seniors chalk them up to just getting older, fatigue, or everyday aches and pains. But subtle warning signs can be your body's quiet cry for help, and recognizing them early could prevent. For example, you might feel occasional leg fatigue or cramping, especially when walking. This is not just tired muscles. It can be a red flag for peripheral artery disease, PAD, which is a form of atherosclerosis that affects the arteries in your legs. As the blood vessels narrow, muscles don't get enough oxygen during activity, causing pain or heaviness that often disappears with rest. Many people ignore this, thinking it's arthritis or simply aging, but it can signal serious vascular problems. Another symptom that often flies under the radar is dizziness or lightheadedness, especially when standing up too quickly or during mild exertion. While this can be related to blood pressure changes or dehydration, it may also indicate reduced blood flow to the brain, a potential warning sign of plaque buildup in the carotid artery. Chest discomfort is one of the most well-known symptoms associated with heart problems, but with atherosclerosis, it may not always feel dramatic. Instead of the classic crushing chest pain, some seniors report a mild pressure, a burning sensation, or an unusual feeling of tightness that comes and goes. These symptoms can be brushed off as indigestion or muscle strain, but they might actually stem from narrowing in the coronary. In some cases, atherosclerosis in the arteries supplying the brain may present as memory issues, confusion, or trouble concentrating, symptoms often attributed to aging or early dementia. But poor circulation to the brain can impair cognitive function even before a stroke occurs. It's also important to note that symptoms can vary depending on which arteries are affected. Coronary arteries, heart, you may experience chest pain, angina, shortness of breath, or fatigue during physical activity. Carotid arteries, brain, warning signs may include sudden dizziness, blurred vision, numbness in the face or limbs, or difficulty speaking, possible indicators of a mini-stroke, transient ischemic attack. Peripheral arteries, limbs. You might notice leg pain when walking, cool or pale skin on your feet, or even slow-healing wounds on your legs or toes. Renal arteries, kidneys. Although rare, narrowing in these arteries may lead to uncontrolled high blood pressure or kidney dysfunction. The real danger lies in waiting for dramatic symptoms to appear. In many cases, by the time atherosclerosis causes noticeable problems, the arteries are already severely narrowed or blocked. At that point, the risk of heart attack, stroke, or other complications is significant. That's why paying attention to small, recurring issues, like leg fatigue, mild chest pressure, or memory lapses, is so critical. These might not seem alarming at first glance, but they can be early indicators of a serious underlying problem. If you or someone you care about is experiencing these symptoms, especially in combination with risk factors like high blood pressure, diabetes, smoking history, or high cholesterol, don't ignore them. Bring them up with your doctor and ask whether screening for atherosclerosis may be a. When left untreated, atherosclerosis doesn't just remain a silent problem, it becomes a ticking time bomb. This disease can quietly damage multiple organs until something sudden and catastrophic happens. The most serious outcomes include heart attacks, strokes, kidney failure, and even limb loss, all of which can drastically reduce both lifespan and quality of life. One of the most immediate and dangerous consequences is a heart attack. As plaque builds up in the coronary arteries, the the vessels that supply oxygen-rich blood to the heart. It narrows the passageway for blood to flow. If the plaque ruptures, a blood clot can quickly form and block the artery entirely. When blood can't reach the heart muscle, the tissue begins to die. This is what causes a heart attack, and it often strikes without warning. According to the Cleveland Clinic, individuals with atherosclerosis are 3 to 4 times more likely to experience a fatal cardiac. Equally concerning is the risk of stroke, which occurs when blood flow to the brain is interrupted. Atherosclerosis often affects the carotid arteries in the neck or smaller vessels in the brain itself. A blockage here can cause brain cells to die within minutes, leading to loss of speech, paralysis, or even death. For many older adults, strokes not only rob them of physical independence but also of cognitive function, making recovery and daily living far more challenging. Kidney failure is another overlooked but severe consequence. The renal arteries supply blood to your kidneys, which are responsible for filtering waste and maintaining blood pressure balance. When these arteries become narrowed or blocked due to plaque buildup, the kidneys begin to lose function. Over time, this may lead to chronic kidney disease or even complete kidney failure, requiring dialysis. In some cases, untreated atherosclerosis can cause critical limb ischemia, a condition where blood flow to the legs or feet becomes severely limited. This can result in non-healing sores, infections, and, in extreme situations, tissue death, gangrene. When this happens, amputation may be the only option to prevent life-threatening complications. This isn't just a medical crisis. It's a deeply emotional and physical loss that dramatically alters a person's. Beyond these physical dangers, untreated atherosclerosis can have a profound effect on quality of life. As the condition worsens, people may find themselves short of breath with minimal activity, constantly fatigued, or in chronic pain. Simple tasks, walking to the mailbox, climbing stairs, or even standing in the kitchen, can become exhausting. The fear of having a heart attack or stroke can also take a toll on mental health, leading to anxiety or depression. There's also the financial burden to consider. Emergency hospitalizations, surgeries, long-term medications, rehabilitation, and possibly assisted living can place an overwhelming strain on personal savings and family resources. According to estimates from the American Heart Association, cardiovascular diseases, including those caused by atherosclerosis, account for hundreds of. And it's not just the individual who suffers. The emotional impact extends to loved ones who may need to take on caregiving roles, make difficult decisions, or witness a family member lose their independence. The stress, worry, and disruptions can deeply affect. While atherosclerosis can progress slowly, the consequences of ignoring it can come quickly and without warning. This is why early detection, lifestyle changes, and medical management are so important. Preventing the disease from progressing isn't just about adding years to your life. It's about preserving the life. How to detect atherosclerosis early. Catching atherosclerosis early can make a life-saving difference. Because this condition often develops silently over many years, routine screening and proactive conversations with your doctor are essential, especially if you're over 60 or have risk factors like high blood pressure, diabetes, The good news is that there are several effective ways to identify signs of atherosclerosis before it leads to a heart attack, stroke, or other serious complications. These tests are widely available, non-invasive or minimally invasive, and can offer a clearer picture of your cardiovascular. One of the first steps is a lipid panel, a simple blood test that measures your cholesterol levels, including total cholesterol, LDL bad cholesterol, HDL good cholesterol, and triglycerides. High LDL or low HDL levels are strong indicators of plaque buildup risk. This test is typically part of a routine physical, but if you haven't had it, another important test is a carotid ultrasound, which uses sound waves to create images of the arteries in your neck that carry blood to your brain. This painless test can show whether there's any plaque buildup or narrowing of the carotid arteries, helping to identify stroke risk before symptoms ever appear. It's especially useful for people with a family history of stroke or known vascular disease. If you experience leg pain when walking, your doctor might recommend an ankle brachial index (ABI) test. This compares the blood pressure in your ankles with the blood pressure in your arms. A lower blood pressure reading in the legs may indicate narrowed or blocked arteries in the lower limbs, signs of peripheral artery disease (PAD), another form of atherosclerosis. The test is quick, non-invasive, and often performed in a primary care. For those at higher risk, a coronary artery calcium (CAC) score, obtained through a special type of CT scan, can help detect calcified plaque in the arteries that supply the heart. This test gives you a numerical score that reflects your level of plaque buildup. A higher score means a higher risk of heart disease. It's a particularly helpful tool for people who have borderline cholesterol level. In general, adults over 60 years old should begin regular cardiovascular screening, even if they feel healthy. But you may need testing earlier if you have any of the following risk factors: a family history of heart disease or stroke, high blood pressure, type 2 diabetes, high cholesterol levels, a history of smoking, obesity or lack of physical activity, a personal history of vascular conditions like PAD or previous. If you fall into any of these categories, talk to your doctor about setting up a screening schedule. Many experts recommend getting your lipid panel checked every 6 to 12 months if you're at elevated risk. Other tests like ABI, carotid ultrasound, or calcium scoring may be done based on your symptoms and medical history. It's also important to share any new or unusual symptoms with your provider, even if they seem mild. Shortness of breath, leg fatigue, or mild chest discomfort may feel easy to ignore, but they can offer early clues that something's wrong. Remember, early detection isn't just about preventing emergencies. It's about giving yourself time to take action, whether that's adjusting your diet, starting medication, or making other lifestyle changes. The earlier you find out, the more options you have to protect your heart, brain, and over. Why older adults should pay special attention to atherosclerosis. As we age, our bodies undergo many changes, some of which are obvious, and others that happen silently inside our blood vessels. One of the most critical health concerns for older adults is atherosclerosis, and there's good reason to take it seriously. According to the Centers for Disease Control and Prevention, CDC, atherosclerosis is one of the leading causes of heart attacks and strokes in adults over 60. For seniors, the risks associated with this condition increase significantly, not just due to age itself, but also because of the many biological and lifestyle factors that build up over time. One of the key reasons older adults are more vulnerable is the natural physiological changes in the blood vessels. As we get older, our arteries tend to become less elastic. In youth, blood vessels can expand and contract easily, allowing smooth blood flow throughout the body. But with age, the arterial walls become stiffer and thicker, a process known as vascular aging. This makes it easier for plaque to stick and harder for blood to flow freely, creating the perfect environment. Another major factor is slowed metabolism. Aging affects the way the body processes fats and sugars, often leading to elevated cholesterol levels and insulin resistance. These shifts can increase levels of LDL, bad cholesterol, in the bloodstream, which is one of the primary contributors to plaque buildup. At the same time, levels of HDL, good cholesterol, often decline, reducing the body's ability to clear. In addition, many seniors experience lipid imbalances, sometimes without realizing it. Even those who feel healthy may have cholesterol or triglyceride levels that quietly climb higher each year. Without regular monitoring and treatment, these imbalances can go unnoticed until serious damage has. On top of these natural aging changes, there's the cumulative effect of risk factors that often go hand in hand with getting older. Over the course of a lifetime, many people develop conditions like high blood pressure, type 2 diabetes, and obesity, all of which accelerate the atherosclerosis process. Long-term habits such as poor diet, lack of physical activity, smoking, even if you quit years ago, and chronic stress all contribute to the wear and tear on arteries. By the time someone reaches their 60s or 70s, these risk factors have often compounded, creating a much higher. For example, studies from Harvard Health Publishing report that seniors with both high blood pressure and elevated cholesterol levels have up to 4 times the risk of having a heart attack compared to younger adults with normal readings. When you factor in diabetes, smoking history, and genetic predisposition, the danger multiplies. It's also important to recognize that the consequences of atherosclerosis are more severe in older adults. A heart attack or stroke at age 40 may be survivable with full recovery. But the same event at age 70 can be far more debilitating, with longer hospital stays, more complications, and a greater chance of losing independence. Recovery tends to be slower, and the body's ability to bounce back is reduced. Additionally, many seniors live with multiple chronic conditions, such as arthritis, kidney disease, or mild cognitive impairment. When atherosclerosis is added to the mix, it can worsen these existing conditions by reducing oxygen delivery to vital organs. In the brain, for instance, poor circulation caused by plaque buildup can contribute to memory loss and confusion, symptoms that are often mistaken for normal aging or. Despite these sobering facts, one of the most dangerous assumptions is thinking, it's too late to change anything now. In truth, early detection and lifestyle changes can still make a powerful difference, even later in life. Medical research shows that managing blood pressure, cholesterol, and blood sugar can significantly slow the progression of atherosclerosis, and in some cases, reduce plaque buildup altogether. Many seniors who adopt healthier habits, like walking daily, eating a heart-healthy diet, and taking prescribed medications, see marked improvements in energy, mobility, and. In short, older adults face greater risks from atherosclerosis, not only because of age, but because of the lifelong accumulation of small imbalances, habits, and untreated conditions. But recognizing those risks and taking action, even now, can protect your heart, brain, and independence well into your later years. How to detect atherosclerosis early. Atherosclerosis is often called a silent disease because it can develop for years without causing noticeable symptoms. But just because you feel fine doesn't mean your arteries are. Early detection is critical, especially for older adults, because the sooner a problem is identified, the more treatment options are available to prevent serious complications like heart attacks or strokes. One of the most common starting points is a blood lipid panel. This basic blood test measures your total cholesterol, LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. High levels of LDL and triglycerides, or low levels of HDL, can signal a higher risk of plaque buildup in the arteries. This test is often part of an annual physical, but if you have a history of heart disease, diabetes, or other risk factors, another useful tool is a carotid artery ultrasound. This non-invasive imaging test uses sound waves to look at the arteries in your neck that carry blood to your brain. It can detect thickening or narrowing of the artery walls, a sign that plaque is forming. Carotid ultrasounds are especially valuable for people with a family history of stroke or who have experienced warning signs like dizziness, numbness, or vision changes. For those who experience leg pain while walking or have poor circulation, a doctor may suggest an ankle brachial index (ABI) test. This quick test compares the blood pressure in your ankles to the blood pressure in your arms. A lower pressure in the legs may indicate peripheral artery disease (PAD), which is caused by plaque buildup in the arteries of the lower limbs. PAD is not only painful, but it's also a sign that atherosclerosis. Another advanced screening option is a coronary artery calcium (CAC) score, which is obtained through a specialized CT scan. This scan looks for hardened calcium deposits in the coronary arteries, those that feed the heart. The test assigns a score based on the amount of calcified plaque found. A higher CAC score indicates a greater risk of heart disease, even in people who otherwise appear healthy. It's especially useful for people who have bored. Generally, adults over the age of 60 should begin having routine cardiovascular screenings, even if they feel well. However, you may need to start earlier or screen more often if you have any of the following risk factors: a family history of heart disease or stroke, high blood pressure, type 2 diabetes, elevated cholesterol, a history of smoking, even if you quit years ago, obesity or a sedentary lifestyle, signs or symptoms of poor circulation. If you fall into any of these categories, speak with your doctor about establishing a personalized screening schedule. For many people with risk factors, it's a good idea to get a blood lipid panel every 6 to 12 months. Other tests like carotid ultrasounds or CAC scans may be recommended depending on your history and symptoms. Even if you've never had symptoms, early testing gives you the power to take preventive steps before complications arise. It allows you and your doctor to build a plan that might include lifestyle changes, medications, or both. Don't wait for a warning sign that may come too late. By taking a proactive approach, you can protect your heart, brain, and arteries, giving yourself the best chance to stay active, independent, and healthy as you age. Lifestyle changes, what really works. When it comes to slowing or even reversing atherosclerosis, lifestyle changes are not just helpful, they're essential. While medications play an important role, especially for people with moderate to severe artery disease, everyday choices about food, movement, and habits can have a powerful effect on your arteries. The good news, it's never too late to make a difference. Even small changes can add up to better heart health. Let's start with nutrition, which is often the foundation of heart health. One of the most recommended approaches by cardiologists is the DASH diet, short for Dietary Approaches to Stop Hypertension. While it was originally designed to help lower blood pressure, DASH also supports healthy cholesterol levels and reduces inflammation in the arteries. The core of this eating pattern is simple: more vegetables, fruits, whole grains, lean proteins like fish and poultry, nuts and legumes, and less saturated. One of the biggest targets in your diet should be sodium, salt. Too much salt raises blood pressure, which puts extra strain on artery walls already weakened by plaque buildup. The American Heart Association recommends limiting sodium intake to no more than 1,500 milligrams per day, about 2/3 of a teaspoon. That means reading food labels carefully, avoiding processed foods like canned soups or frozen. Another key change is cutting back on saturated fats, which are found in butter, full-fat dairy, fatty cuts of meat, and many packaged snacks. These fats can raise LDL bad cholesterol and contribute to plaque buildup. Instead, aim for healthy fats, especially omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, as well as flax seeds, chia seeds, and walnuts. Omega-3s help reduce inflammation and may even Equally important is physical activity. You don't need to run marathons or join a gym. For most seniors, simply walking for 30 minutes a day, 5 days a week, can significantly improve circulation, lower blood pressure, and boost overall heart function. Walking is gentle on the joints, doesn't require special equipment, and can be done anywhere. If walking isn't possible, chair exercises, light stretching, or gentle yoga can be excellent alternatives. The key is consistency. Physical activity not only improves your cardiovascular system, but also supports better balance, mood, and mobility, all critical for maintaining independence as you age. If you have any medical limitations, talk to your doctor or a physical therapist about a safe and personalized exercise. Beyond food and movement, managing stress plays a major role in cardiovascular health. Chronic stress raises cortisol levels, which can lead to high blood pressure, weight gain, and inflammation, all of which worsen atherosclerosis. While some stress is unavoidable, the goal is to develop healthy ways to cope. That could include meditation, deep breathing exercises, prayer, spending time in nature, or simply enjoying a favorite hobby. Even a few minutes a day of quiet time can lower stress hormones and improve your heart rhythm. Another critical component of healthy living is quality sleep. Poor sleep, or not enough of it, can increase your risk for heart disease, diabetes, and obesity. Aim for 7 to 9 hours of restful sleep each night. If you're experiencing trouble falling asleep, staying asleep, or waking up feeling unrefreshed, talk to your doctor. Sometimes untreated sleep apnea or other disorders may be to blame, and addressing them can improve both your sleep and your cardio. And of course, if you're still smoking, or even occasionally using tobacco, quitting is one of the most important things you can do for your arteries. Smoking damages the inner lining of the blood vessels, speeds up plaque formation, and reduces oxygen delivery to your tissues. The benefits of quitting begin almost immediately. Within weeks, your blood pressure drops, circulation improves, and your heart attack risk starts to decline. If quitting feels difficult, ask your healthcare provider about counseling, medications. Finally, for many seniors, medications may be necessary alongside lifestyle changes, especially if blood pressure, cholesterol, or blood sugar levels are hard to manage with diet and exercise alone. Two of the most commonly prescribed medications for atherosclerosis, statins, which help lower LDL cholesterol and reduce inflammation in the arteries, low-dose aspirin, which may help prevent blood clots from forming on unstable plaque. Not everyone needs these medications, but for many older adults, they are a safe and effective part of a prevention strategy. Always talk to your doctor before starting or stopping any medication. The goal is to find a treatment plan that's right for your personal risk profile and lifestyle. Whether you're 60 or 85, meaningful improvements can still happen. Eating better, moving more, quitting tobacco, getting good sleep, managing stress, and working with your doctor on appropriate screening and medications. These aren't radical changes. They're small, doable shifts that over time add up to a stronger heart and a longer, more active life. And beyond all the lab numbers and tests, what's really at stake here is freedom. The ability to walk without pain, to remember your grandchildren's names, to live at home instead of in a facility, to drive, to enjoy your meals, to laugh. Your health isn't just in your doctor's hands, it's in your own. Every step you take to protect your arteries is a step toward keeping your independence, your clarity, and your So now you know atherosclerosis isn't just about blocked arteries. It's about your energy, your memory, your freedom to move, and the life you want to keep living. No matter your age, you can take steps, real, simple steps, to protect your arteries and take back control of your health. Whether it's a short walk after breakfast, swapping salt for herbs, or just making that doctor's appointment you've been putting off, here on Age Stronger, we believe aging is not something to fear. It's a chapter full of wisdom, resilience, and new beginnings. And the better you care for your heart, the more life you'll get to enjoy with the people who matter most. If this video helped you or gave you something to think about, let us know in the comments below. We love hearing your stories. And don't forget, like, share, and subscribe to Age Stronger so you never miss an update that could help you or someone you love. Thank you for spending time with us today. Take care of your heart, take care of yourself. And we'll see you in the next video.